so we're going to talk about IT band syndrome, but first we need to figure out exactly what that means. So the IT band is a band of connective tissue that runs from pretty much the top of your hip and inserts here at the outer knee. So a lot of times people will have outer knee pain and or hip pain. So when the IT band is too tight, sometimes it can come from the glutes or the back part here being too weak. So we're going to show you some stretches and exercises to help correct that and make it more manageable. All right, so I've touched on this before, but when we're talking about IT band syndrome, if this is working too hard, 9 times out of 10, your glute med is not working hard enough, so it's too weak. So there's 2 ways to tell if your glute is weak or inhibited, and I've already kind of showed you guys this previously, but the first way is to stand on the leg and lift your other leg up to 90 degrees. So I'm wobbling a little bit because this is actually my bad side, but you should be able to hold this without dropping from side to side. If when you stand, you drop that hip, you can tell that that glute is inhibited on that side, so we need to activate it. The other thing you can do is lay on the ground, and what you're gonna do is lift your top leg up with driving through that heel and bring it back just a little bit. You should be able to hold this for 60 seconds without dropping the leg. You'll feel a good burn right here, and that will tell you if your glute is firing or not. So now we figured out that our glutes are weak and we've still got that IT band pain. So the first exercise you're gonna do is a clamshell. So you're gonna take your knees, keep them even, and your feet touching each other. I'm propped up against a wall right now so that my hips will stay perpendicular, because sometimes people try to cheat and roll too far forward. So what you're gonna do is lift this top leg up, 1, 2, 3, and back down for 3. You're gonna do this 10 times for 3 sets on that involved side up. All right, so after you've done your clamshell, you're gonna lay out nice and straight like this. We're gonna kind of repeat that test that we used to determine if we have weak glutes, and now we're gonna turn it into an exercise. So what you're gonna do is take that top leg, drive through your heel, and come back just a little bit to activate that glute. Hold for 3 seconds and bring it back down. And you're gonna do this 10 times, 3 sets. All right, now you're halfway through, so what we're gonna do is we're gonna manually release any knots that we feel along this IT band. So you're gonna use your thumb, and again, be very careful with this because you don't wanna bruise or apply too much pressure. So just start with gentle pressure kind of right up here on the hip with that thumb, and as you apply light pressure, go ahead and extend that leg out just like that, and then flex your foot at the end. And then you'll bring it back, and you'll kind of work down the leg a little bit here. Probably every 1.5 to 2 inches, just applying a gentle amount of pressure to manually release some of the adhesive buildup in that band. Okay, so to keep everything consistent on my left side, now I'm going to use the foam roller. So I want to be very clear about using the foam roller that if you're someone who's having a lot of outer knee pain, you do not want to use that foam roller right here on the knee because there actually is a fat pad here. So when you use the roller with compressive force, it actually will inflame this area a little bit more. So what you're going to focus on, especially if you have pain right here, is really rolling more of the TFL and the mid belly there of that IT band. So you're going to place your roller, and this one has kind of raised pieces to it. So this is actually going to be a deeper roll. But you're going to place the roller down, you're going to prop yourself up on that involved hip, and then you're gently going to roll up and down a couple passes. You don't really have to do too much because foam rollers can be very tender at first. And like I said, if you have a lot of pain here, you're going to kind of want to stop mid-leg there. All right, so the last thing we're going to do is get our resistance band or dog leash or belt or whatever you have at home. We're going to do a nice IT band stretch. So we're going to start by lifting that leg. Then you're going to take both handles and put it in your opposite hand so that it can help stabilize you as you glide that leg down. Slowly glide your leg towards the floor, and you'll start to feel a good pull along the top of that IT band and even a little bit into your glute. And then if you want to get a deeper stretch, go ahead and flex that foot. You'll feel that in your calf as well. So you're going to hold this for 20 to 30 seconds and repeat 3 times.